Good evening, everyone. This is Dr. Schilling from Sequoia Health, bringing you this week's Wednesday Wellness Minutes, and we're coming off fresh of the Patient Appreciation Week, and we want to thank all of you who came out and took part in that. We hope you enjoyed it and hope it was beneficial for you. This week's Wednesday Wellness Minutes, we're going to be talking about blood pressure. I'm going to give you a few points, as you can see on the screen here, to discuss, and then we'll provide more information that you can read more about in the blog. First of all, we want to understand the negative side effects of blood pressure: stroke, heart attacks, Alzheimer's disease, kidney disease. If you know anyone who's had high blood pressure and these things develop, it's as a result of that high blood pressure because it puts a lot of back pressure on the system and things start to break down after a while. Causes are generally misunderstood. In a natural world, in an alternative health standpoint, we're looking at stress being the biggest cause of high blood pressure, and that can be mental emotional stress, neurological stress, it can be food stress, it can be toxin stress. So just to add a few in there, inflammation is a big problem. Our culture is based on sugar and amphetamines and stimulants and things like that, with caffeine and things like that, which all raise your inflammation, which causes stress on your vessels, on your blood vessels. And that then causes pressure on the heart. So that causes your blood pressure to rise. Generally speaking, when you think of blood pressure, people think 120/80 is the high water mark, but really that's a line in the sand, and they added that as a guideline just so you'd have a place to mark yourself. So they usually say 120 to 139, and then so on and so forth as far as your systolic, and then 80 to 90 those all hypertensive states. But you want to be aware of what yours is ongoing and what is consistently, so you know where you are. So just think of 120/80 as a general line in the sand to mark your progress on. The neurological stresses, from a neuroemotional standpoint, especially coming off an advanced QNRT seminar, I'm thinking about inability to love or inability to connect and overwhelm are all related to the heart. And though therefore there can be neurological stressors from early in life and or inherited stresses that can come into your DNA and be triggered and that cause heart issues down the road. Metabolic, in our world, an underlying cause of blood pressure issues is going to be liver toxicity. And if you think about all your blood flows from your heart out your arteries and then comes back to your liver through your veins. If there's a lot of congestion at the liver, a lot of toxicity, or a lot of viral stress or parasitic stress or whatever it might be in the liver, that can cause challenges and push back. A lot of people with varicose veins, it's usually related to some type of liver stress that's causing the blood vessels to dilate, and then the leaky valves happen and the blood can't get out. So that's just to keep that in the back of your mind. One of the common problems with blood pressure is the medications. If you go to a medical doctor and they're trying to help you, they're going to give you medication because that's the best tool they have. Understand that there are risks involved. Potentially cancer developing and or even blindness can be caused as a result of blood pressure medication. So make sure you understand the risks and side effects as well as the benefits of taking that medication. Prevention is where we want to start. In our world, prevention is the cure, so we want to think about simple things. Think about decreasing your stress, increasing your breathing exercises, practicing mindfulness, doing some meditation. It doesn't have to be, you have to be a Zen master to do it. Quiet, focused thinking, think about health, wellness, envision your body healing, things like that. Exercise is also very critical. It doesn't have to be extraneous. Just think about walking. Walking is great for cardiovascular health and decreasing stuck blood flow and lymph flow. Okay? Supplementation is a good place to start if you need help. D3 is optimal at 50 to 70 nanograms per milliliter, if you will. So get your D3 tested through your blood, figure out what your levels are. Omega-3 fatty acids are fantastic. Those are really good at softening the arterial walls and making sure your blood pressure isn't too high. Probiotics are very important because a lot of your biochemistry is dependent on your gut to give the neurotransmitters back to your brain, so that is crucial there. And increasing your veggies. Mom always said, eat your veggies first, right? So increasing your veggies, getting the fiber going, getting the colon cleared out, and decreasing the stress on your nervous system and on your digestive system, which is all going to lower your blood pressure. Certainly hope this has been beneficial. If you have any questions regarding blood pressure and how to manage that, we're happy to help. Please give us your ideas on future Wednesday Wellness Minutes so we can make this beneficial for you and enhance your quality of life and help you on your path for health. We look forward to seeing you next week.